Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and preparing well for upcoming NORCET exams and railway exams also. Okay, and a very surprising announcement by the government, that is our 8th CPC, the pay commission they have announced. So that will be implemented around 2026. So why I'm telling regarding this pay commission means earlier it is at the level of grades level 7 the nurses are entering. That means grade 2 nurses are entering into the nursing field. They will get around 80 to 1 lakh as a entry salary. But after this 8th pay commission, that will be nearly to the double. So nearly to the 2 lakh salary will be there. So put over all the efforts and try to crack the exam and get a central government job. Okay, that will be very benefit for your family and as well as for you. So that is why I'm giving this information. Okay, in our channel we are posting important topics and important MCQs for your purpose. Please subscribe our channel and utilize this opportunity. And whoever want to join the class, you can contact the Metier team and you can join the course. Okay, we'll start with a small quote. When you are ready to quit, just remember how good you look at in the white coat. So that means you think about when you are preparing for the exams or when you are going to think about quitting, you are going to stop. That time you think that how, if I am become a nurse, how will be, how my life will be. Think like that. If you are a central government, if you are getting a central government job, how your life will be beautiful. ஓகேவா? நீங்க ஒரு விஷயத்தை நிறுத்த போறீங்க, இல்ல ப்ரிப்பேர் பண்ணிட்டு இருக்கும்போது உங்களால முடியலன்னு சொல்லி நிறுத்த போறீங்கன்னா திங்க் பண்ணுங்க, நம்மளுக்கு இந்த ஜாப் கிடைச்சா நம்மளுக்கு எவ்வளவு நல்லா இருக்கும் நம்ம லைஃப், அவ்வளோ சேலரி வாங்கும்போது நம்ம ஃபேமிலி எப்படி செட்டில் ஆகும். ஸோ திங்க் ஆல் ஆஃப் தோஸ், then prepare. You have to prepare for your family and for your future. Okay, think about the future and prepare well now. Okay, we'll start today's session. Today we are going to see about oncology related questions. Okay, oncology related questions. First question: what is the treatment method for a client with a benign lung tumor? The options: the tumor is treated with radiation only, the tumor is treated with chemotherapy only, the tumor is left alone unless symptoms are present, the tumor is removed involving the least possible amount of tissue. What is that? What is the correct answer? The correct answer is option D. The tumor is removed involving the least possible amount of tissue. We'll come into the options. The tumor is treated with radiation therapy. Very rarely the tumors are directly treated with the radiation first of all. No. Very, very rarely only they will do. The options for the tumor, the surgery, the treatment options for any tumor, first they will remove the tumor. Then they will give the radiation therapy. Then they will go with the chemotherapy. So this is the order for removing the tumors. Okay. While doing the surgery, while removing the tissue, then they will send it for the pathological examination. So that pathological examination will tell that whether it is an what kind of a tumor, whether it's a recurrent type of tumor, whether it's a malignant type of tumor, those will be done in the other side. Okay. So here the option is the tumor can be removed successfully with the surgery. Okay, mostly the surgeon will remove entire part of the tumor. Only if it is in a risky case, only they will leave the piece of the tumor inside that same organ. Why? It means that organ, the tumor may be invaded the organ. That is why they are not removing entire part. 98% only they will remove, remaining 2% will be in the organ. That 2% will be treated with the radiation and chemotherapy. Okay, yes. Here the option D is the correct one. Second question: the treatment that uses light and energy aimed at an exact tissue location and depth to vaporize the cancer cell is what? The options: en bloc dissection, photoablation, debulking, diathermy. The correct option is photoablation. Photoablation is what? They will use a a high energy light directly into the tumor, especially in the tumor of the throat. Okay, that time they will use the vaporizing. They will try to vaporize the cancer cells using the high density light and energy. Okay, that is called photoablation. So the name itself, photo means light. Okay, you can remember like that. Okay, what is en bloc dissection? Option A they given. For any tumor, for example, any tumor in the, for example, I am having the tumor in my left elbow. Okay, left elbow, I am having the tumor. So in the joint, they will try to remove the tumor as well as wherever the tissue it's affected, entire joint, they will take it out. En bloc, entire joint, they will take it out. Then they will replace the joint with the artificial one. Okay, they will replace the artificial. That is en bloc dissection. Not only tumor, wherever the tumor they try to invade, wherever the tumor tissues are touched, they will remove entire part. Okay, that is en bloc dissection. Debulking is nothing but, for example, I am having the brain tumor. The size was very big, so the surgeon couldn't take out entire tumor from my brain. So they will reduce the size. Okay, they reduce the at least 75% remove within one surgery, then wait for some time, then remove the remaining part. That is debulking. Bulking means bigger one. Debulking means only the size they will remove. Size they will reduce. They will do it and they will remove surgery. Okay. What is diathermy? Diathermy is nothing but using the electrical current to cauterize or to remove the tissues. That is diathermy. Okay. Here the correct option is photoablation. Next question. The process of precisely destroying cancer tissue in the brain by using radiation is called what? Photodynamic therapy, cryosurgery, gamma knife surgery, robotic surgery. The correct option is gamma knife surgery. What is gamma knife surgery? It's one of the accurate type of method. Okay, they will use some what is it called? Yes, it's a helmet type device will be there, or some metallic screw metals will be there. So after that, they will place it in a machine, that is a gamma knife machine. So the gamma radiation will be precisely will target the tumor in the brain. Okay, that will erode the brain tissues. That is gamma knife radiation. That is the process of precisely destroying the cancerous tissues in the brain using the radiation. That is gamma knife radiation. What is photodynamic therapy? Option A. Photodynamic therapy is nothing but if the patient having any type of cancer, they will give with a tablet called photosensitizer. Okay, the tablet they will give it to the patient. So the patient will take that tablet, photosensitive tablet. Then they will wait for 24 to 72 hours. After that, the patient will be exposed to the light. Either it's a sunlight, either it's a UV light. Okay. So what will happen after this patient exposed to the UV light or a sunlight? So he taken the photosensitizer, no? That will be absorbed by the cancer cells. Okay. Within the 24 to 72 hours, the tablet will be absorbed by the cancer cells. So after exposing, because of the photosensitization action, all the cancer cells will be started destroying. Okay, it started destroying. It is photodynamic therapy. புரிஞ்சுதுங்களா? ஒரு ஃபோட்டோ சென்சிட்டிவான ஒரு டேப்லெட் கொடுப்பாங்க. அந்த டேப்லெட் எடுத்த உடனே பேஷண்ட் 24 to 72 ஹவர்ஸ் வெயிட் பண்ணணும். அதுக்கப்புறம் அவங்க பேஷண்ட்டை வந்து சன்லைட்லையோ யூவி லைட்லையோ எக்ஸ்போஷர் பண்ணும்போது அவங்க என்ன சாப்பிட்டாங்க? அது வந்து ஒரு ஃபோட்டோ சென்சிடைசர். ஸோ ஃபோட்டோ சென்சிட்டிவிட்டி அந்த லைட்டில் எக்ஸ்போஷர் ஆகும்போது ஆல்ரெடி இந்த கேன்சர் செல்ஸ் அந்த டேப்லெட்டை சாப்பிட்ருக்கும். ஸோ சென்சிட்டிவிட்டி ஆகி அந்த கேன்சர் செல்ஸ் எல்லாம் டிஸ்ட்ராய் ஆகும். அதுதான் ஃபோட்டோடைனமிக் தெரப்பி. வாட் இஸ் cryosurgery? Using nitrous oxide, okay, or liquid nitrogen, they will remove the tissues. That is cryosurgery. Robotic surgery, you all know that. Advanced method of surgery using the robots. Without only the surgeon will use the buttons. Okay. Yes. Question number 4. Which gloves should be used by the nurse during preparation of chemotherapy? Latex gloves, silicone gloves, nitrile gloves, plastic gloves. The correct option is nitrile gloves. Why? Nitrile gloves are chemotherapy or any drug can be resistance. That capacity to resistant drugs to get inside the nurses or any medical practitioners in hand, in the skin. Okay, so that is why we have to use the nitrile gloves. The capacity of the nitrile gloves, they are very rarely get turned. Okay, அவ்வளவு சீக்கிரமா கிளியாது. ஓகேவா ஓகேவா பட் லேட்டக்ஸ் gloves and all easily get allergies. Okay, easily get turned. So that is why you should not use a latex gloves. We should use the nitrile gloves. Okay, silicone gloves and all very costlier, but we are not using in the hospital setups mostly. You may see in the households cleaning and all, vessel cleaning and all, we using silicone gloves. Plastic gloves for the purpose of any chemical spills or any puncture proof container. That time only we are using the plastic gloves. Okay, here nitrile gloves are the correct option. So today's last question, question number 5. Frequency of clinical breast examination is every 3 years, every 6 months, once a year, every month. The question look like simple, but you have to read it carefully. The question is asking about the clinical breast examination. It's not about self breast examination. If it is self breast examination, it is every month. After the puberty, every month we have to do it. That is self breast examination. The question is asking clinical breast examination. The time period is actually 1 to 3 years. So best we have to go for yearly once to prevent the breast cancer. Clear? You got the point? 1 to 3 years we can averagely. But exactly we can, if it is do it in a once in a year, that clinical breast examination by any physician, that is well and good to prevent the breast cancer. So here they are given options. Clinical examination once a year is good. But if any family history of hereditary, then best to do it in the 6 to 12 months. Okay, mammogram once a year or hereditary risk means we can do a mammogram along with the breast MRI is good options. Okay, yes. So that's all about today's session. Thank you so much. I hope you understand the class and it will be helpful for you. If you like the class, please press like button. And if you have any doubts, please type it in the comment box. Thank you all and all the best.